Alrighty.
Okay.
Yeah, we're ready.
Okay, go ahead.
Hey, ladies. Are you recording it too?
Yeah.
Welcome. Can you hear us okay? Give us a thumbs up if you can. Good, 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 good. Everyone. Awesome. Welcome, Lisa. Lisa, what's your last name?
Jones.
What was it?
I'm Jones.
Ah, cool. Welcome, welcome. We're so excited to have all you ladies here. Today we're going to be talking about, first off, this is going to be recorded, so just keep that in mind. We're going to change it over to a single screen in just a little bit. But at the end of our presentation or this demonstration, we'll also open it up for questions. So at the very end, probably about 20, 25 after, so we'll open it up for questions, and then you guys will all be able to have the option to ask any of your thoughts. All right, so first off, we're gonna do first aid. This is for general assessment. Something just happened and it's kind of, what do you do next? So Erin, my friend here, is going to be our victim, and we'll have her kind of be our bloody victim on the floor. First off, this is a guidebook we're gonna have in everyone's, probably backwards, but we're gonna have this in every assistant guide backpack or first aid kit. And in this is where we are taking the information from today. So all these things are gonna be spelled out for you in this little booklet. So first off, we come upon a victim, and according to the action checklist on here, we have stay calm, check to make sure the scene is safe, do our initial assessment, focused assessment, history, plan, written record, and act. So first thing we're going to talk about is staying calm. Something happens, it's always crazy, and you freak out, or don't freak out, depending on how awesome you are. But most people freak out, so first thing you want to do is like, take a breath. All right, and then we're ready for action. Second thing is making sure that the scene is safe. When I took an EMT class, they had to go like this, like actually physically stop and like check and make sure the scene is safe. What kind of things are we looking for in a dangerous situation before you even like get on the scene? Sorry, you all are muted. But any thoughts? If you want to unmute yourself. I don't know if we know how to do that. Okay, I will answer for you.
I can do it individually.
Okay.
Or they can do it.
I will answer for you. We'll just kind of go and we'll do questions at the end and not worry about muting. So dangerous things would be, I'm gonna have Erin answer some of her thoughts. What's the dangerous situations?
Natural falling rocks, sliding rocks, falling trees, cars, animals, angry hikers, angry animals.
All these kind of things.
Weather.
If it's a vehicle that's involved, you want to make sure there's no fumes or chemicals or anything like that that could explode down power lines, that kind of stuff, power lines and water, those kind of things. There's some things that you will not even touch a victim if those things are happening. So just always remember that before you run in. I went in on an accident once, and it was in the mountains, and the car was wrapped around a tree. Before we rushed in, we should have assessed that the car was stable before we jumped in. Luckily it was, but those are some things that you got to think about first. All right, so we're looking for hazards. We're also looking at what caused the injury. It's called a mechanism of injury. And then we want to make sure we ourselves are safe. So the things that we would put on would be, before we even touch somebody, in our first aid kits, we've got gloves. If you need, right now everyone's gonna have masks. All our first aid kits have masks. If there's stuff shooting everywhere, goo, I don't know, we have goggles in there too. But you wanna protect yourself. At minimum, you wanna have gloves. And then hopefully a mask as well. And then you're also looking around to see how many patients are out there. If you have one person you're taking care of, or just a handful. in this particular situation, this was when I was in college. There was multiple victims when we pulled up, and it was in, of course, the middle of the night. They were drunk and they'd wrapped their car around a tree. We get up there and one guy is screaming, and one guy is sitting, not saying anything on the ground. And then they say there's some guy in the truck that hasn't woken up. And so you've got to figure out, who are you going to triage first? Who would you think would be the most important person to triage of those three guys?
The person with the most serious injury.
Mm-hmm. And how would you determine that?
Visually, I could, sometimes visually, sometimes you'd have to ask them.
Mm-hmm.
Sometimes, if they're not conscious, that can be a big sign. It can be a sign that they're gone.
Mm-hmm. Yeah, if someone's passed away, obviously your priority changes. So in this situation, there was a guy running around. Luckily, there was two of us. One guy was running around screaming, and the other guy was quiet. So my friend went and talked to those two, and I went and checked the guy that was in the car, the truck that was non-responsive. And of those, if you have someone who's unconscious, that changes your priority. Obviously, unconscious people would be your number one priority. If you're able to get to people who you can see they're severely bleeding out and other things are happening that they're going to quickly become unconscious, also take that into consideration. All right, so then we're gonna do our initial assessment. I'm gonna have Erin, she's gonna be our victim here. So go ahead and lie down. I wanna make sure that you guys, I'm gonna have you lie down in front of me right here.
This way?
Yeah. Be patient, we are newbies at this, so I'm gonna change this so you guys can hopefully see Erin and her funness. Let's see. Can you still see me?
What do I have? What symptoms do I have?
Okay, Erin's gonna tell us stuff as we go, but essentially my initial assessment is I'm taking care of all things that need to happen right now. So these are the life-saving, like immediate things that could be going on. So this is where you get your ABC, your ABCs. We're also going to include D and E as well. So A would be airway, absolutely. So the first thing we're going to check is if she's got an open airway. If you come on somebody and your victim is talking to you, you've already got A and B done. Just saying. But if they're unconscious or something's happening, the first thing we want to do is check their airway, make sure there's no obstructions, open her mouth. I'm not seeing anything in there. I would also, then we go to B, breathing, and I do that thing that you guys are going to learn your CPR. She's holding her breath. I'm like, is this a real symptom?
I have tacos.
But anyway, we have B for breathing. You're checking to make sure that they're breathing, and you're also looking at their chest to make sure it's going up and down. You're also looking for B breathing, rapid breathing, wheezing, other things that could go on with their breathing. Also, it's a nice thing to do when you come upon them. First thing, I should back up to that, is I usually like to keep my hand on their forehead, because what this does is remind me, unless I know exactly, unless I saw her sprain her ankle, I'm coming on someone, I don't know if I need to maintain spinal precautions or if there's been a head or neck injury. So usually I put my hand on their head just like this. And I would actually introduce myself. Hey, my name is Emily. I am, I'm in a first aid trained, and I'd like to help you. Is that okay? All right, so she gives me a thumbs up. Unless they say absolutely not, if they're unconscious, then it's assumed that you can take care of them. All right, so we go ahead and we're saying, okay, we'll take care of them. And we're assessing her level of consciousness. Her eyes are open, her eyes are rolling around. But yeah, generally I'm just seeing that she's not doing so good. She's not very communicative. All right, so I checked airway, breathing. Does any breathing hurt? Do you have any pain with your breathing? Yes? Okay, it hurts to breathe? Okay. All right, so that's something that we need to know. I'm checking to make sure that if she's breathing okay, then I know I don't have to do rescue breathing, but this would be the place that I would do rescue breathing if we were at that point. Then this first, A, B, C, D, E's are really quick. So C, circulation, I'm gonna go ahead and check her pulse, and you check that on the radial pulse with these two fingers. The radial location is on your thumb. I always think rad for radial, and you're checking right there on her pulse, and I'm checking to see if it's racing, if it's not present, or if it's weak, What am I feeling?
Not normal, healthy heartbeat.
A normal, healthy heartbeat. Okay, so she's doing okay with that. And I'm also just checking to make sure I'm not seeing bleeding or anything like that. So I know that circulation seems to be doing okay. But you're checking for, yeah, heart rate and for lots of blood. D is for disability. Disability is spinal stuff. So I'm checking to make sure that I keep everything aligned, because if she had a fall, I don't know what's going on. And then E is environment. Depending on my situation, usually cold is the most concerning situation. So if we have a sleeping bag, we want to make sure that we can get someone over with a sleeping bag, put it on her, keep her warm. If we're in a hot desert kind of place, we're looking at ways to keep her shaded. If there's other people around, if we need to get her clothing wet to cool her body down, that kind of stuff, that'd be E environment. So that's our initial assessment. So what I did is I came in, put my hand on her forehead, introduced myself, A, B, C, disability, and then E for environment. So we went through those pretty quickly. All right, then we do our focused assessment. So since I noticed, what were the things that I noticed with that exam? I noticed difficulty breathing. Anything else? Okay, so she was just having difficulty breathing. What we're gonna do, so I'm like, okay, breathing is what I'm mostly worried about. I'm not seeing any deformities, like broken bones, cuts, bruises.
You're asking me.
Yeah.
My ankle.
Your ankle, which ankle?
Is broken.
It's deformed or in pain?
Yes.
Okay, which ankle was that?
My left.
Your left ankle. So I would have noticed something was screwed up with her left ankle. So we'll assess that later. Okay, so the big thing right now is I'm more concerned, we've got an ankle injury and we've got difficulty breathing. Of those two things, what do you think is more important? The breathing. Remember, A, B, C, Ds. Those are the things that we want to take care of first. I mean, if she's got ankle, leg issues, unless we're having blood circulation issues, we're going to take care of those things later. So we're going to do our head to toe focused exam. We're going to be looking and make sure we're not going to miss anything else that she's not telling us. So we're going to look at things, asking her questions. We're feeling things. So this is a very hands-on kind of thing. So first we're going to look at the head. I'm making sure when I'm looking at her, I'm not seeing any depressions in the skull, lacerations. You can actually feel around the skull. Looking for damage to her eyes, drainage from her ears, nose, or mouth. Am I seeing anything like that? No. Okay, great. Then I'm going to go to her neck. I'm looking at her neck. I'm looking for like tracheal deviation, anything like screwy, swollen, anything like that. Do I see anything like that? No. Okay, great. Also looking for any pain. Do you have any pain in your neck? No. Okay. Then we go to shoulders. Same thing. Pain. Are you feeling any pain?
Just a little bit in the shoulder.
Left shoulder pain. And then I'm looking to see if there's like, are they all like, it looks like we have dislocation or something. Do I see anything like that? No. Okay, so we just have left shoulder pain. We're going to the chest. All right, do you have any pain in your chest?
Just when I breathe right here.
Okay, point exactly where it hurts.
Right here.
Right there. Does it hurt when you breathe in or out or both?
Both.
Okay, breathing in and out. Okay, I'm going to go in and I'm going to gently feel her lungs. I want you to take a deep breath in and a breath out. Okay, I'm watching to see if that makes her cough or if she's coughing up blood or anything else, if her respirations change. Did anything change when you did that?
It hurt more.
It hurt more? Okay. I'm checking for possible rib fractures. Am I feeling any gross deformities as I'm feeling your chest?
Yes.
Do I feel like depression, significant depression, or just some tenderness there?
Like asking after rib.
Okay. Fractured ribs are really hard to tell. If you have, it's just a fractured rib and it's these lower ribs, you may or may not be able to feel anything at all. The really big concern with fractured ribs, if you have a rib that's broken, say this is my rib and it's broken here and broken here, so you have a middle section that's moving independently. And you can feel, if you have someone breathe in and out, you'll feel like the bone go in, or it'll be moving separately. So that's something you want to check. You want to make sure that those bones are not going to be, that you don't have a punctured lung. That's the concern, big concern. You would notice severe changes in breathing, sometimes foaming and stuff like that. So that would be our biggest concern if we had a fractured rib, is we don't want that to puncture a lung. All right, so right now I'm suspecting fractured rib. It seems pretty stable, so I'm going to keep on moving. But I'm watching her for breathing to make sure it doesn't change. All right, we're going to go to your abdomen. All right, and feel, you've got 4 quadrants. You got your belly button, 1, 2, 3, 4. So left lower, left upper, all those kind of things. I'm feeling for any sort of hardness or pain. Are you feeling, when I push that, do you feel anything? Okay. And we're gonna go into more detail about abdominal injuries, chest injuries, all that kind of stuff in the future. So don't worry, this is just doing the assessment. All right. Then we're gonna go to pelvis. And what I do is I feel on these top bones, your pelvic bones, and I'm just gonna gently push down. I'm checking for a pelvic fracture. Any questions with that? Any pain with that when I do that? Great. Okay. Then I want to, if there's anything genital area-ish, you know, that they got hit there, you know, there's some things that we might have to actually get and check out. Most of the time, it's not a concern, but do ask, you know, how does it feel in that area? You're doing okay? Right, no pain or anything, no swelling, especially guys, that's a big deal for them. All right, legs. I'm gonna be checking down the legs, checking for pain. Any pain when I'm touching your legs? And then I would have her bend her knee. Any pain with that knee? All right. And then I'm going to have her bend, you can't see, but bend her ankle. All right. And then I would have her on this injured ankle. Can you move that ankle at all? Okay. All right. I'm going to have her wiggle her toes. Can you wiggle your toes? She can wiggle them a little bit. Then I'm also checking for discoloration in that foot. Is there discoloration?
Not yet.
Okay. If there's discoloration, that means the bones have broken to the point where they're stopping blood from going, and that is that changes that injury into a severe injury. But if we still have circulation, we're doing okay so far. We're just going to kind of keep an eye on it. All right. Then we're going to go back to the arms, checking arms for pain. Any pain, deformity in your arms?
Just, it's all scratched up.
Okay, arms scratched up and shoulders tender. All right. I'm going to go ahead and move her arm, her hand. Any pain with this? Okay. And if I go like this?
Just a little bit.
Okay, she's not screaming in pain, which was a good thing. So it has some discomfort. So it kind of helps me know the level of that injury. All right. And then we are going to check, if I'm able to I want to check her back as well. So if I had somebody else, what we would do is we'd keep her in spinal precautions, and we're going to keep her, I would have somebody supporting her head like this, and we'd roll her to the side and try and keep that all in line. So pretend like someone's doing that. I'm checking her back. I'm pushing on every single vertebrae, and you can do that pretty quickly. Are you feeling any pain when I push on these? Okay, great. And then don't nod your head that you're bring you back. But I can also, if I suspect any back injuries, I'm also checking skin at the same time. So while you're doing these assessments, if you want to provide some privacy, that's a really good idea, because you're probably going to be looking under their shirt, checking their pants, you know, making sure there's no hidden injuries. That's also a very big concern. If any of you guys are ever EMTs, you know, the first thing they do, and if there's suspected trauma, is they take all your clothes off. They cut everything off just so you don't have any weird surprises, especially if bruising is coming up, and especially in an abdominal area or something like that. We want to catch that pretty quick. So anyway, that's your focused exam. All righty. And then we're going to move to vital signs. I want to check and see first, vital sign is level of consciousness. So I'm going to say, hi, what's your name?
Erin.
Okay, she can talk to me, so she's conscious. That's a good thing. She knows, and I'm assuming someone can verify her name. And I would ask her name. So it's person, place, time, and why she's there. So where are you at right now?
I'm on Mount Timanogus.
Mount Timanogus, we are on Mount Timanogus, okay. And then what time is it, what day is it?
It's July 5th.
All right, I'm gonna say that's not right. And then how did you get here?
I was hiking, and it got really hot, and then I woke up here. Like
Okay,
this.
she was hiking, it was hot, and then she ended up here. So we've got some gap of memory of what's happened with her. So that makes me concerned. And if she has anybody who's with her, they might be able to provide some more information about exactly what happened. Would any of your friends pretend we're talking to your friends and they offer some more information, which would be?
That I overheated and blacked out, and I fell down the hill.
They tell us exactly what happened. She overheated, fell down, blacked out, and fell down the hill, and now she has injuries. Okay, so maybe when I had put my hand on her forehead, I would have felt that she was pretty hot. So right now, I'm on the vital signs section, level of consciousness. She's conscious, and she's oriented to herself, location, and what happened. So that's 1, 2, 3 out of the 4. So it's called an LOC times 3. So that's pretty good considering. Then we're gonna make sure that she's responding to pain. I learned when I did my assessment that she was like, ow, that hurt. Sometimes if someone's unconscious, that's a good thing. Like she's responding to me verbally, but if someone's unconscious, maybe the only response I'm getting from them is a painful response. So you would say unconscious, but responds to pain. Sometimes you have someone who's unconscious that does not even respond to pain. That means they're pretty far gone, like they're in a deep coma, and that's even worse. So it's good to know if they're responding to verbal stimulation and painful stimulation. Heart rate, I would check her heart rate, and I'm finding, you wanna check how many beats a minute. A quick way to do that is how many beats every 15 seconds, and then you times it by 4. That's what I do as a nurse. If you've got a watch, that's awesome. Otherwise, I try and estimate 1, 1,000, 2, 1,000, 3, 1,000, 4, and do that until I get to 15. All right, so I'm checking her heart rate. I wanna make sure, let's say she's at 20. I counted 20 beats in those 15 seconds, times it by 4, that gets me to 80. Heart rate needs to be between 60 and 100, so she's doing okay. So not too bad. With someone who's in severe dehydration, if she's getting over 100, 110, 120, 130, all that kind of stuff, we are in serious concerns that we need to be calling paramedics or getting help as soon as possible. All right, then we're also checking, one of my tricks is we also need to check respiratory rate. I will just continue to pretend like I'm checking their heart rate and count another 15 seconds for her respirations. So we can just do that right now. I'm just gonna count 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 9, 1,000, 10, 1,000, 11, 1,000, 12, 13,000, 14,000, 15. Okay. So we've got her at 6 breaths every 4, so it's 20 breaths of 24. Normal breathing is between 12 and 20. So she's breathing a little on the faster side. And then she seems to have some guarding on that lung, that left side. All right, so another thing we're gonna have for all our guides, or at least our lead guide, is gonna be a pulse oximeter. So we're gonna be checking that as well. You just put them on their finger. The finger needs to be warm and pink. If it's freezing cold, you're not gonna get a good reading. All right, and it's gonna tell me 2 numbers. The top number is oxygen, the bottom number is heart rate. So it'll double check my heart rate. And it's 64. Okay, I lied on the heart rate. All right, but her oxygen is 96. Oxygens always wanna stay above 90. All right, if we start getting below 90s, then we're gonna have concerns. When we start taking people on trips up in the high altitude mountains, anything above 8,000, and we're concerned about some sort of acute mountain sickness or things like that, we're gonna be checking oxygen. If they drop below 90 at any point, we send them back. And we pretty much will send them home. So that's a big thing we wanna watch. Also, anyone that we might know has respiratory issues like asthma or things like that, we can check that pulse and make sure we know what's going on. Then I'm also checking skin color, temperature, moisture. So we're gonna probably try and have thermometers for most of our bags. Normal temperature is 97.8. If we got someone below 96, that's when I'm worried about cold. If we get someone over 100, 100.0 is when we worry about fevers, temperatures, and say like I feel her, she's feeling pretty hot, sweaty, clammy, and we check a temperature on her and she's probably 100.2 or something like that, 100 or even 100.1 would be concerning. So we'll definitely want to try and cool her down as soon as possible, get her hydrated as she's able to. And then, so that is our vital signs. So that was checking her consciousness and how she responds to pain, and then checking her heart rate, checking her respiratory rate, checking her oxygen on her finger, and then checking her skin temperature. So vital signs. Those are important things that we want to get to have good information. And now we're going to do a history. It's called sample. All you guys are going to get in every first aid kit, there's going to be, it's called a SOAP note. It was one of the papers that you can download. On here, it spells out samples, so you don't have to really remember this, but essentially, whatever we can, and I would recommend, you're in an emergency situation, you're just going to be doing all this really fast. And so what we're going to do is ask that one of our other guides, if possible, might be writing, or someone that you feel is dependable in our group, will be writing down your observations. So we've got patient name, date, age, gender, all this kind of stuff. So there's a place for vital signs, heart rate, respiratory rate, things that you observed, and then the sample that we're going to go over. So hopefully they're going to be taking notes while you're going through these things as well. So under sample S, those are signs and symptoms, things that I'm noticing. So I'm going to say there's, it says we're under. Sorry, how many more minutes do we have left? Sorry.
4.
Okay. So sample is just a way of checking our signs and symptoms. Allergies, medications, medical history, last oral intake, and events leading up to the assessment. So these are things you'd write down. Now, obviously, if something's in a life and death situation, you're going to take care of that life emergency. I can't think of the word. Anyway, you're going to take care of that and kind of take care of all this information as you're moving down, loading and going and all that kind of stuff. But if you're like, I think I can stay a few minutes and we're going to get a little bit more information that might help paint a better picture and help you take better care of your person. So you're going to get like a general history of the person. And then we're going to make a plan of what we're going to do. So with her, I would say, it looks like we've got some damaged ribs and we've got a bad ankle. We're going to definitely need to load and go and get moving. If she can bear weight on that, then we'll do it, and that's great. If not, we're going to have to do a litter situation and probably need some evacuation. So that would be our plan. So go ahead and take a look at this document. I put it on the Facebook page. Just know that the SOAP notes are anytime an incident happens, this is what we're going to be using while we're in the emergency. And then anytime you open up a first aid kit, even for a bandage, you're going to be firing an incident report. So the incident reports are something that you would file after the fact. So incident reports just say reported by, what happened, location, what happened, people involved, did we have to file a police report, reporting officer, all that kind of stuff. So take a look at those forms. They're going to be in all the first aid kits, so you'll be able to get to know about them. Anyway, any questions? We got like 2 minutes. That was like a fire hose. I'm so sorry. And those of you guys are going to be taking your first aid and CPR classes. I know one of them's going to be going on this Saturday. He'll go through a lot of that information.
Oh, I didn't know that. Okay, so what days are the first aid certification days?
Marilyn,
Brian Nelson is teaching an in-person first aid CPR and AED certification on September 12th. Saturday, September 12th. It goes from 8 a.m. until 3 p.m. If you want to do that, it's going to be at his office in Orem. I think there's like 5 of us taking it. If you want to do that, let me know, let me know, text me or whatever, because he's getting everything sorted out right now.
Any other questions?
Is that the only day he's doing it? Is on the 12th?
Yes, the 12th is the only day that he is doing it. He's doing it, it's in person. The only other option is to do like Red Crosses online or something. It's in person and he's doing it for free. The only cost to us is the cost to certify, I guess the Red Cross, or I think it's actually his is through American Heart Association. So we're just paying $24 for the certification itself. And then I think there's like a $2 or $3 or $4 little booklet that we keep. So the total would be about $28 paid day of. He'll probably do another one in the spring, but this is his first time. I mean, he teaches this as a profession, but it's his first time teaching it to a group for free.
Cool. Thank you.
Other questions? Cool. This is like a fire hose, so hopefully when you do a first aid and CPR class, that'll kind of help reiterate. Feel free to watch this Zoom meeting as many times as you want, and then those documents literally spelled out exactly what we just talked about and went over. So feel free to look at those or print them off or whatever floats your boat. And all of you guys are going to be getting one of these booklets in your first aid kit that you'll have access to, and it talks about this in like the first 2 pages. So we're going to be, hopefully in the future, we'll be doing more scenarios when we can meet in person, and we'll be kind of going through these again. So we'll review this again. Awesome. Well, thank you ladies so much for joining us. Feel free to stay tuned for the next couple minutes. We're going to switch over to mountain biking fun. So we'll see you guys soon.